Thank you for coming this morning. I'm Ron Winslow. I'm board chair for Hunt Memorial Hospital District, and on behalf of the directors, we want to welcome you here. We're pleased to have some exciting news this morning, and I'm going to ask our CEO, Rich Carter, to fill you in on some really exciting things that are happening.
On behalf of the staff at Hunt Regional Medical Center here, I want to thank everybody for joining us, all the press and a few employees and all the members of the community as well. We're very pleased to have some exciting news to share with you today. First off, I want to acknowledge that the organization has worked long and hard on this initiative. And here at Hunt Regional, our purpose and desire has always been to be a hospital that provides really high quality, comprehensive care. And for most of our existence, which this hospital I think was developed or started back in the 70s, but for most of our existence, we have been a great community-based hospital focused on traditional service lines, things like OB and surgery, and we changed our name to Hunt Regional. You may recall that. That was back in 2009. And then we started adding some new service lines to our organization to open up a new service line, for which you have come to attend today, for which there is a tremendous need. And this is something that we've been working on for many years, and that is a full-time interventional cardiac service line. So what that means is that we are hoping to fill this void in our services here at the center, and we are planning to kick this off and begin this effective June 12th. So you can put that on your calendar. Effective June 12th, we will begin the cardiac service line. We've joined forces with a new dedicated partner, Medical City, who's in attendance with here today, and I will introduce them in a second. Recruited two full-time interventional cardiologists, Dr. Roger Belbel and Dr. Ahad Hassan. They also are up here on the podium. We'll get a chance to introduce them in a minute just as well. So our goal is to be able to deliver comprehensive cardiac care 24 hours a day, 7 days a week, 365 days a year. So what that means is long gone are the days of transfers to Dallas for stents, transfers to Dallas for other cardiac procedures, waiting overnight for cardiac consults, waiting over the weekend for cardiac consults, which is what we have been able to provide for many, many years, and that is going to change effective June 12th. So we are ushering in a new era of services here at Hunt Regional, and we are very thrilled to offer this higher level of care right here in our own backyards. Find out in a few minutes are very well trained. They have over 40 years of combined experience in cardiac patient care. Dr. Belbel is retired from the U.S. Marine Corps, so we appreciate you and your service. Pardon? Oh, the Army, I'm sorry.
Hey, Army.
Okay. All right, well, if that's the only mistake I make today, then I've had a good day. And he's also served as president of Elite Cardiology, director of the Advanced Heart Failure Program, and chief cardiologist in El Paso. Dr. Hassan is certified by the American Board of Internal Medicine in interventional cardiology and cardiovascular disease. So we're proud to have them here and joining us, and we hope that you make them welcome.
My name's Chris Vaughn. I'm the CEO of Medical City Dallas, and it's really my honor and pleasure to be here today. And I appreciate, Rich, the kind words and introduction. I'm honored to attend and celebrate this monumental milestone with our partners at Hunt Regional Medical Center. And Medical City Dallas is proud to partner with Hunt Regional to bring new, life-saving interventional cardiology services to this community. So please join me in congratulating this team. They've done all the work and opening the groundbreaking new cath lab for patients in Greenville and beyond. So I'm grateful to be part of such a strong healthcare partnership, which helps us all emphasize on what we're here for, and that's the care and improvement of human life.
Thank you for the fabulous introduction. Both Dr. Hassan and I are thrilled to be here, and we're really looking forward to providing interventional care and overall cardiovascular care to this community. We're both really thrilled to be here, and it's going to be our honor and privilege we're really excited to get started, and it's going to be exciting. We want to be involved in this community as much as we can, and we're truly, both of us, blessed to have this opportunity, and also to have Medical City backing us. So it's an incredible affiliation and an incredible program that's been put together.
Thank you, Richard. I'm glad that finally it's moving forward. It's been like 9 months talking with you. Let me introduce myself. Actually, I was trained in New York, and then I spent 3 years in Georgia. And that was a similar hospital, and with the same experience building a cardiac program over there. And I moved to Texas last year because my wife is from Texas. To provide the necessary services to the community locally, and patients don't have to drive 30-40 miles to go to a bigger city to get the quality care. And at the same time also, these kind of smaller programs, they need a backup from a bigger hospital, and I'm glad that Medical City will be at our back to support us in this program. Thank you.
Thank you very much. We have.
How large a process this is for the hospital district? How many patients do you anticipate, caring for this program?
It is a large endeavor. This has been many, many years in the making. Actually, I think we initially began to develop the desire for interventional cardiology services probably a dozen years ago, if not longer. So it's taken some time. Hunt County is, as in many ways, a county that is very underserved in this arena. So there is a strong need. The historical utilization of cath procedures in Hunt County has been in the hundreds, probably 500 or 600 cases a year. And that's probably even a little bit old data. So there is a lot of transfer on a daily basis from Greenville to Dallas and other places as well for cardiac services that can be served here locally in the future, either from both an emergent perspective and an elective perspective. So not all cath cases are emergent, but many are. And so we want to serve all needs from the population, and we've got the staff now to
Is service being able to be provided to other counties in the region? For example, Hopkins County, the hospital, I don't know what their capabilities are, but do you anticipate that they're going to utilize the services here?
So yes, we do have the need and the ability to reach outside of our local community of Hunt County, and so we can be used in that capacity. We're surrounded by several counties which have very little healthcare services. Rains County, Delta County, obviously. Hopkins County has some service lines, which we are broader than they are, but we duplicate in other service lines. So yes, we do plan to reach out in all directions, north, south, east, and west, and take care of all those patients who choose to use us. I'm not sure I have the answer to that. How many staff are dedicated to the
Right now we're at
7?
7.
Okay, so we'll have 7, and they're back here in blue shirts, as you can see. This line is actually going to be managed by Medical City. So these physicians are Medical City physicians, and the cath program will be managed by Medical City. And Dennis is actually an employee of theirs. So he is here full time, and we're proud to have him, and we look forward to him being a part of us just as much as he is part of Medical City. Of course, it's always up to patient choice first and foremost, but the facility in Rains County is a physician's office. So if a patient did present there, maybe if they're having chest pains, they better be calling 911, right?
Some of them are.
But let's say they showed up there and then they needed some cardiac consultative services, then they can come to Greenville and receive those services. And if they needed an interventional procedure, then we can accommodate them.
An important first step in an evolution of the clinical care that you're going to be able to provide. And I think what you'll see over time is that the clinical team and the management team will continue to expand its clinical expertise in the services that are provided in this community, and you'll see fewer and fewer patients that over time will be transferred out of the community and the care will be given here. That's what I think you'll see.
That is the goal.
Be part of this program and this team and Hunt Regional and the community, so that the care can be provided here where it's needed. That's always the best place for it. You know, if you can avoid being transferred out of your community, it's better for the patient, better for the family, and it's just a better continuity of care. So we're really proud to partner with you and look forward to a long-term relationship. So congratulations.
Thank you. And Ron, on behalf of the board, do you have any final comments?
I would just say that Rich said we kind of started talking about this about 10, 12 years ago, and I really pushed hard to get Rich to get us hooked up with someone that could really help us. And I'm just really pleased that it's Medical City, and we look forward to being associated with you. And I think we're all going to be surprised at how successful it'll be.
The only thing is I'm very grateful to be here. And, we are going to do our best to provide the quality services to the people of the Greenville. And as you mentioned, people will be surprised that they don't have to travel that far to get the quality care. And from the cardiovascular point of view, I can tell you is probably more than 90% of the services we are going to provide. It's only those 5 to 10% that are highly complex cases like TAVRs and surgical cases, that complex PCS, that will be, they have to go to the Medical City.